In this cool sculpting procedure training video, we will discuss how to use the vacuum applicator on the male chest. Topics include how to assess the chest, plan the treatment with markings, place the applicator, and position the patient. For the right candidate, the Cool Curve Plus applicator is ideal for treating the chest, but a cool core may also be used. To determine the best fit, use the applicator planning templates. During treatment, the vacuum applicator draws tissue between two cold plates to deliver uniform cooling to the treatment area. For consistent, aesthetically pleasing outcomes, patient selection and the assessment process are essential. An experienced physician should determine if the patient has true gynecomastia or treatable fat during the consultation. The cool sculpting procedure should not be used on patients with gynecomastia. Here are some of the outcomes you can expect when following the recommended treatment protocols. On treatment day, document the patient's weight on the treatment planning form. Change the patient into disposable shorts and take baseline 360-degree photos using the foot positioning guide. To clearly see the treatment area during the assessment, ask the patient to stand with their arms relaxed behind their back and weight evenly distributed on both feet. Observe at eye level to the treatment area and visually identify how the tissue naturally presents on the body. Asymmetry is common. Discuss differences in fat distribution with the patient, as it will affect the marking and placement of the applicator. Before marking the patient, wipe the treatment area with alcohol to remove excess oil or lotion from the skin. Pinch the tissue and determine the natural orientation of the bulge. Identify and mark where the tissue tapers medially and laterally on the chest. Use the applicator planning templates to identify the best applicator for treatment. Align the cooling panel on the applicator planning template to the medial marking on the patient. Draw a line from one end of the template to the other, extending the line 1 inch or 2.5 centimeters on both sides. Mark the end of the template to help you position the applicator at the correct angle. Mark the cooling panels to identify the area that will be treated. Remove the applicator and extend the cooling panel lines. The cooling panels on the template should meet both the medial and lateral lines. This may require more than one application with an overlap of cooling panels. Use different colored pens to better define the treatment markings. Step away and visually assess your markings to confirm complete coverage. To prepare for placement of the applicator, seat the patient in a reclined position on the treatment bed. Place an absorbent pad on their lap to capture any residual gel. Center and gently drape the gel pad between the two cooling panel markings. Working from the center outward, use the back of your fingers to smooth the gel pad and eliminate any wrinkles or air bubbles. Recommended settings for the vacuum are 60, 75, and 60. Engage the vacuum by pressing the vacuum button on the applicator touchpad. Do not rock or roll the applicator into place. Apply the applicator straight on following the treatment markings. The patient will feel sensations of deep pulling, tugging, and pinching as the applicator draws the tissue. Verify that the gel pad is extended past the applicator's cooling panels and check to see if there is sufficient contact with the cooling panels. If the placement is incorrect, turn off the vacuum, remove the applicator, replace the gel pad, and repeat the applicator placement process. Insufficient tissue draw may result in a pop-off situation. To deliver therapeutic cold to the treatment area, tissue must make contact with the cooling panels. Maximum tissue exposure to the cooling panels will result in a greater opportunity for fat cell death. Once you have confirmed sufficient tissue draw, secure the applicator in the support arm. Use pillows to support the applicator and improve the comfort of the patient. After the patient is in position, engage cooling. Common side effects include an intense cold, tingling, stinging, aching, and cramping as the cooling begins. These sensations generally subside as the area becomes numb. However, there have been several reports that when treating the male chest, the patient may continue to feel pressure and discomfort throughout the treatment. Patients have also reported that the vacuum suction pulls at the hair on their chest, causing an uncomfortable sensation upon deployment. Talk to your patient about possibly shaving before the day of the procedure. When applying more than one applicator at a time, allow enough time between the two treatments for the 2-minute manual massage. Use the Cool Sculpting Treatment Planning Form to record the details including patient weight, applicator, placement, and general patient observations. Before leaving the treatment room, cover the patient with a blanket or sheet. Encourage the patient to move as little as possible during treatment to avoid popping off the applicator. Return to the room before the treatment ends and talk to the patient about what to expect during the applicator removal process. Immediately after cooling has ended, turn off the vacuum. Release the vacuum seal by sliding your finger between the patient's skin and the edges of the applicator cup. Remove the single-use gel pad and begin to administer a 2-minute massage. Begin the post-treatment massage immediately after the treatment ends to manipulate the fat cells when they are at their most crystallized state. In the first minute, vigorously knead the treatment area. In the second minute, apply a deep pressure massage in a circular motion. The same person should administer the massage on both sides for consistency. The patient should stretch and use the bathroom prior to the second treatment. In the days and weeks following treatment, the patient may experience redness, bruising, swelling, tenderness, cramping, and aching. Sensations of itching, skin sensitivity, or numbness can last several weeks after treatment. These sensations are normal, but instruct your patient to contact you if they worsen over time. Patients may begin to see results in as early as 3 weeks, but will experience the most dramatic results between 1 and 3 months. Bring the patient back after 30 days for a follow-up medical assessment to review results, reassess, and determine if additional treatments are needed. Treatment of the male chest may take more than one treatment session, so set expectations with your patient during the consultation. With a variety of applicators, the Cool Sculpting system allows you to create customized treatment plans to fit the individual needs of your patients. The Cool Curve Plus and Cool Core applicators are preferred for treatment of the male chest. For ideal patient outcomes, determine if the patient is a good candidate for treatment. Assess the treatment area while the patient is standing. Identify where the treatment begins and ends. Use applicator planning templates to mark the treatment area. Ensure the cooling panels meet where the tissue begins and ends. Seat the patient in a reclined position. Apply the single-use gel pad, engage the vacuum, and apply the applicator following the treatment markings. Initiate cooling only after the patient is comfortable. Immediately after cooling has ended, administer a 2-minute manual massage. To make the Cool Sculpting procedure successful in your practice, properly educate patients on what they can expect during and after treatment. Deliver transformational results by performing a 360-degree assessment and developing a customized treatment plan. Provide the patient with a positive experience by creating a relaxed and welcoming environment. Stay tuned to see additional assessments of the male chest. Thank you for partnering with us. We look forward to helping you make the cool sculpting procedure a success in your practice. Results and patient experiences may vary. During the procedure, the patient may experience deep pulling, tugging, pinching, numbness, or discomfort. Following the procedure, typical side effects include temporary numbness, redness, swelling, bruising, firmness, tingling, stinging, and pain. Rare side effects may also occur. The cool sculpting procedure is not for everyone. Patients should not have the cool sculpting procedure if they suffer from cryoglobulinemia or paroxysmal cold hemoglobinuria. The cool sculpting procedure is not a treatment for obesity. As with any medical procedure, a consultation should be done by a licensed physician to determine if the patient is a candidate for treatment. Consult the Cool Sculpting System user manual for a complete list of contraindications and potential side effects. Treatment applications that deviate from the guidelines are not recommended.